Welcome to Brainetainment, your go-to place for mind-enriching knowledge. Here we aim to enlighten, entertain, and educate you on a myriad of fascinating topics. From the mysteries of the universe to the inner workings of our bodies, we've got it all. We strive to make learning not only informative but also enjoyable, so sit back, relax, and get ready to boost your brain power with our intriguing range of educational content. In today's episode, we will delve into a critical health topic, heart disease. First, we need to understand what exactly a heart disease is. Simply put, heart disease refers to a range of conditions affecting your heart. It's not one single condition, but a collection of issues that can occur when your heart isn't working as it should. There are several different types of heart diseases. The most common one is coronary artery disease, which happens when the major blood vessels that supply your heart with blood, oxygen, and nutrients become damaged or diseased. Then we have heart rhythm problems or arrhythmias, and heart defects you're born with, known as congenital heart defects, among others. Heart disease is a significant health concern worldwide, and for a good reason. It's the leading cause of death globally, claiming millions of lives each year. It's an indiscriminate killer, affecting people of all ages, genders, and backgrounds. The severity of heart disease varies greatly from person to person. For some, it's a minor inconvenience. For others, it's a debilitating condition that severely impacts their quality of life. And for many, it's a silent killer, showing no signs or symptoms until it's too late. Understanding heart disease is the first step towards preventing it. By knowing the different types and how they affect our bodies, we can begin to take steps to protect our heart health. Now that we have a basic understanding of heart disease, let's explore its causes. Various factors can lead to heart disease. Some are within our control, while others, unfortunately, are not. But let's not get ahead of ourselves, shall we? First, let's delve into the lifestyle factors. Our daily habits can significantly impact our heart health. A diet high in saturated fats, for instance, can lead to the buildup of cholesterol in our arteries, a condition known as atherosclerosis. This narrows the arteries, making it harder for blood to flow through, which can trigger a heart attack. In addition, physical inactivity is another key player. Regular exercise helps maintain a healthy heart by reducing blood pressure and improving circulation. So, if you're spending most of your day on the couch, your heart might not be too chuffed about it. Now let's talk about the silent killer, stress. Chronic, unmanaged stress can increase your heart rate and blood pressure, leading to damage over time. It's also linked to behaviors that increase heart disease risk, like smoking and excessive drinking. Speaking of which, excessive alcohol and tobacco use are also significant contributors. They can damage the heart muscles and arteries, leading to heart disease. But it's not all about lifestyle. Unfortunately, some of us are predisposed to heart disease due to our genetics. If your family has a history of heart disease, you might be at a higher risk. Other underlying health conditions can also increase the risk. Conditions like high blood pressure, diabetes, and obesity are often linked to heart disease. Lastly, age and sex also play a part. Heart disease risk increases as you get older, and men are generally at a higher risk than women. Understanding these causes helps us identify the symptoms of heart disease. But remember, knowledge is power. By understanding these factors, we can take steps to reduce our risk and keep our hearts happy and healthy. Heart disease often shows warning signs. An understanding of these signs is crucial to early detection and intervention. The symptoms of heart disease can be quite diverse, varying from person to person, based on the type of heart disease and other individual factors such as age, gender, and overall health. One of the most commonly recognized symptoms of heart disease is chest discomfort. This isn't always the intense, clutching heart attack pain that we often see dramatized. It can be more subtle, feeling like pressure, tightness, or a squeezing sensation in your chest. Next, shortness of breath is a potentially significant symptom. If you find yourself panting or huffing after minimal exertion, or even at rest, it might be a signal that not all is well with your heart. Other symptoms can be more subtle and could be easily dismissed as signs of aging or being out of shape. These include fatigue, dizziness, and lightheadedness. If you're frequently feeling tired or dizzy, it's worth getting it checked out. Heart disease can also manifest in irregular heartbeats or arrhythmias. A fluttering in your chest, a racing heartbeat, or a slow beat can all be signs of heart disease. Symptoms can also vary widely between men and women. While chest pain is the most common symptom for both, women are more likely than men to experience some of the subtler symptoms, such as shortness of breath, nausea, and extreme fatigue. Remember, heart disease is a sneaky adversary. It can present with symptoms that are easy to ignore or dismiss. Persistent symptoms, even if they seem minor, should never be ignored. And let's not forget, sometimes heart disease shows no symptoms at all until a major event like a heart attack occurs. That's why preventive measures and regular checkups are so vital. In conclusion, heart disease is a complex condition with a range of possible symptoms. It's essential to listen to your body and seek medical advice if you notice anything unusual. Recognizing these symptoms early can lead to prompt treatment and better outcomes. Awareness is your first line of defense against this silent killer. Prevention is always better than cure, especially when it comes to heart disease. Let's talk about how to prevent heart disease, which is as significant, if not more so, than treating it. A heart-healthy lifestyle is the cornerstone of prevention, and it's never too early or too late to start. First and foremost, we need to make healthy lifestyle choices. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy can work wonders. Keep an eye on your salt and sugar intake, and aim to keep it minimal. Regular physical activity is another crucial preventive measure. Try to get at least 30 minutes of moderate exercise like brisk walking or cycling most days of the week. Exercise helps control weight, reduces blood pressure, and boosts your heart health. Smoking and excessive alcohol consumption are significant risk factors for heart disease. So if you smoke, quit. And if you drink, do so in moderation. Remember, every step you take towards a healthier lifestyle makes a difference. Regular health checkups are also essential. These help detect potential issues before they become serious. High blood pressure and high cholesterol can damage your heart and blood vessels, but without testing for them, you probably won't know whether you have these conditions. Regular screening can help you keep these numbers in check. Lastly, if you have underlying health conditions like diabetes or obesity, managing them effectively is key. These conditions can increase your risk of heart disease, so work closely with your healthcare provider to control them. Remember, it's not just one thing, but a combination of these lifestyle choices that can steer you away from heart disease. It's about making healthy choices every day, whether it's opting for a salad over a burger, taking the stairs instead of the elevator, or choosing water over soda. Adopting these preventive measures can significantly reduce the risk of heart disease. Prevention is not just about living longer, but living better, with a stronger, healthier heart. So let's make these changes today for a healthier tomorrow. To recap, heart disease is a serious health concern with various causes and symptoms. It's a complex condition that can manifest in various forms, from coronary artery disease to heart rhythm problems. The one common thread is that they all involve damage to the heart muscle or the heart's electrical system, affecting its ability to pump blood effectively. We've covered how heart disease can result from an array of factors. These can range from lifestyle choices, such as poor diet and lack of exercise, to genetic predispositions and other health conditions like diabetes or high blood pressure. It's crucial to remember that no one factor alone causes heart disease. It's often a combination of several that leads to its development. In terms of symptoms, heart disease can be a silent attacker, often showing no signs until a significant event like a heart attack occurs. However, there are some common symptoms to look out for, such as chest pain, shortness of breath, and fatigue. The key is to listen to your body and seek medical advice if you notice any changes. Of course, understanding heart disease is only the first step. The real power lies in prevention. We've discussed how maintaining a healthy lifestyle, which includes regular exercise, a balanced diet, and quitting smoking, can dramatically reduce your risk. Regular checkups and screenings are also essential to catch any potential issues early and start treatment immediately. However, if you or a loved one is already living with heart disease, don't despair. Modern medicine has made great strides in treating and managing heart disease. From medication to surgical interventions, there are options available to help manage the condition and improve quality of life. In conclusion, heart disease is a multifaceted condition, but with knowledge and proactive measures, we can combat it effectively. Let's not underestimate the power of prevention and the importance of early detection. Thank you for watching. Stay tuned to Brainetainment for more enlightening discussions. Remember to subscribe and share our content to enrich others' minds too.